Welcome to the Heart of CIRS podcast. I'm your hostess, Melanie Joy Pensack, here to share heartfelt conversations with folks recovering from CIRS and with those special people serving the CIRS community. The podcast was created to help bring awareness to the physical, emotional, and mental experiences of folks navigating CIRS day to day. The world needs to know what CIRS folks go through for deeper empathy and understanding. Through stories and vulnerability, we can help the world understand the winding journey of CIRS recovery. Thank you for being here to open your mind and to open your heart. Hello, everyone. I am very excited to have Dr. Laura Varga here with us today on the Heart of CIRS podcast. Laura is somebody that I have connected with through the Surviving Mold community. She is a wonderful person and a really sweet soul, and she's got some really interesting things to share with us today about CIRS and GU syndrome. We both really appreciate Eastern medicine and Western medicine, and we also really share a strong interest in meditation, wisdom traditions, and contemplation. So I think that you're going to really enjoy what she has to say today. Laura, thank you so much for being here.
Well, thank you for having me, Melanie. I appreciate it.
So tell us about your background and your medical training to date so that people can get to know you better.
Sure. I'd love to. Yeah, I was, kind of reflecting this morning, and it's been quite a journey these last 30 years. And kind of how it's weaved its way in between Eastern and Western medicine. I'll start from the beginning. I got my bachelor's from the University of Pennsylvania. I had really a great experience in there. It was very exciting, very academic. I was a psychology major and was sort of on track to get a PhD in psychology. And I took this course called physiological psychology. So how does the body feel thirsty? How does it feel hungry? And then they had another major that opened up called biological basis of behavior. So I started taking courses through there, kind of the mechanics of, depression, anxiety. And that was very interesting to me. I actually had a dream for a week straight, and it was calling me to, it was like, paging me over the system and in a hospital as I was more of like a physiological doctor versus, a psychology doctor. I was like, oh, so then I started to lean towards being more of a medical doctor and began to take pre-med courses. Also at UPenn, I had the opportunity to work in research. I worked with that psychology professor who taught physiological psychology. And I also got a job in the Department of Psychiatry. There was a scientist who was looking at reuptake at norepinephrine receptors. So I got to see bench work, laboratory science. And then next door was neurology. So we'd get cadaver brains in from people who had Alzheimer's disease, Parkinson's disease. And so it would sort of be all hands on deck, and we'd be in there to help, slice it up and divide it and get all the parts and pieces ready for research. So, I kind of got to hold in my hands, wow, this is what an Alzheimer's brain looks like, or a Parkinson's, and it would be different. So that was very interesting. After I graduated, I moved to San Diego, California, and I worked at UCSD. Had a wonderful opportunity there, again, with many different physicians, departments of psychiatry, gastroenterology, pulmonary medicine. These were mainly pharmaceutical drug research trials. So that was fortunate. I got to see phase 1 through phase 4 research, at the ground level. I also had the wonderful opportunity to work with a pediatric infectious disease doctor, Dr. Jane C. Burns, and we looked at Kawasaki disease, and we did a retrospective multi-center review of what cerebrospinal fluid values look like. And in addition to that, I got to write the research paper with her. I got to go on grand rounds with her. Anytime a Kawasaki patient was in San Diego County, I got to go to the hospital with her. That was really a wonderful opportunity. And then kind of fast forward. So in California, I grew up in Connecticut. In California, there's much more of an Asian influence. And I was doing triathlons, and, a lot of the athletes get massage. So I started to get massage and body work. And the woman shared an office with an acupuncturist, and she said, well, why don't you go see her for your allergies and your asthma? So I did, and that opened the door to Eastern medicine. And as life would have it, in the early 2000s, the US offered a degree called, which is what I have now, the DAOM. So we first offered the master's in Eastern medicine in the 80s, and then later we offered the DAOM, which is an additional 2 years, and you combine Western and Eastern medicine and the study of more advanced disease. Also there, I got to do, at my graduate school, I got to do work with a couple of researchers, Richard Hammerschlag and Rosa Schneier. Richard Hammerschlag is a PhD. Rosa Schneier is a DAOM who's done quite a bit of research. She used to be at Harvard, again, having more background in research and experience. And when I graduated, I got a job at Duke University's Department of Integrative Medicine. So I was working in a center alongside Western doctors. Wonderful experience to have been able to be on the hospital charting system. So I had ready access to, if a patient had just had a surgery or they're, seeing this particular specialist, I could read their notes, read their medications, their procedures. So was very blessed to have that experience. And then I went out into private practice. And over the years, I bumped into functional medicine. I started studying some of that, ordering some of the testing, incorporating that into my practice. Then 2 years ago, I called a mentor to ask about a urinary mycology test. And she said, take my course on CIRS. It's a quick course, and then call me back. So I did. That just opened the floodgates, opened up a different lens to seeing people that had been difficult for me to help, also in myself, because I have CIRS. That was in 2022. Then also I bumped into an Eastern mentor who specializes, a lot of his practice is, and we'll get into this discussion, on goo. So then I began to study an Eastern person. The woman who recommended her CIRS course, she said, you really need to get, shoemaker certified if you want to treat this. So I got my proficiency provider in 2023.
I love hearing all the details of your background. I mean,
yeah,
you think about where you are now and all of those different experiences, how they will really enrich the patients that you're working with, to have all those diverse areas that you've had a chance to experience. Really incredible.
Thank you. Yeah, I really feel like it's come full circle. It's like I'm at a place now where it pulls on all those experiences.
Can you share a little bit about your CIRS experience? You've pointed to the fact that you are recovering from CIRS as well. What can you share with people about your journey in terms of, maybe red flags that will help them to better understand their own experience, and whatever you feel comfortable highlighting?
Sure. My first CIRS hit was when I was 6 years old. That was my first biotoxin exposure. So for any of the parents out there, I was this lively kid who loved being outside, loved swimming, just loved the woods, vivid imagination. And then I turned into this tired, chronic headache, chronic digestive issues, kind of depressed, if you can imagine, just as such a young kid, but just tremendous fatigue. And then I think you could say kind of like a fragile nervous system, kind of reactive, going, let's say meeting new kids or being dropped off at a birthday party. So there definitely was a big switch, and sort of in, physical, mental, emotional. I did get things like allergies, and then later asthma, predominant fatigue. Interestingly, I sort of did a meditation on this, and I could see that then when I was a teenager, I think when the hormones set in, I got this kind of energy from that, different from like sort of a feeling of vitality that I had prior to that exposure at 6. But it did give me energy. I was able to do very well in university. I was able to train for triathlons and do quite a bit of exercise, but there still was an underlying fatigue. Then there were things that I couldn't treat. Like I could treat my allergies and asthma with Eastern medicine. I cured it in a year or two with providers and treatment. But the things like I had horrific menstrual pain, and I could make some headway with other kinds of treatment, but I couldn't get that pattern out of my system. Headaches, I couldn't quite deal with that. Digestion, I could improve with changing my diet, taking herbs, but again, over my lifespan, it's been an uphill battle. Then I think too, the hormones coming down, in my late 30s, I saw an uptake in, I used to always be a really good sleeper. Then sleep started to be difficult, more kind of anxiety. And then certainly, like putting myself under the pressure of graduate school, just almost constant headaches. I think what I'd like to convey is, you can, in my experience, I would make efforts to make things better, like my digestion, or work with other symptoms, and I can get improvement, but the overall trajectory is that, decreasing. In Eastern medicine, we'd say that decreasing of the life force of vitality.
That brings us to CIRS and GU syndrome. And so I find this all to be very fascinating. Just to be really clear, are we saying that CIRS is GU syndrome in Eastern medicine?
Yes, we'll get into I'll use some different terminologies, but yes, it in its most simple form, it does combine that exposure plus that vulnerability. So in CIRS, we'd say that, mutation on chromosome 6, so a genetic vulnerability to it. Eastern medicine, we're going to use different languages, but those two combined give you CIRS or give you GU syndrome.
Great. So tell us more about this.
What I want to do is start out, at first I'd like to just thank Dr. Heiner Fruhoff for his tenacity, going back into the classical literature and making this treatment approach available to us. I'd also like to thank Richie Shoemaker for his research and dedication, and also to Adyashanti, who taught me true meditation. And then before we get into the treatment with herbs and acupuncture, I wanted to speak first to kind of a diagnostic approach of Eastern medicine to set us up for what we're going to talk about. Through the lens of Eastern medicine, there is this inherent interconnectedness and relationship within ourself. So for example, when we learn about the organ systems, we learn about how they're all connected to one another. And then also within our outer world, Chinese medicine based on Taoism is very much looking at the patterns in nature and then applying that to the patterns in our body. Also, we are aware that we're not this encapsulated entity that's not affected by our environment. We take into consideration the seasons, the climate that we live in, relationships, et cetera, et cetera. Also, spirit plays a role, and I'll speak briefly to that. Also, this inherent relationship between the physical, mental, emotional, and spiritual aspects of the human body. I find that one of the most compassionate things to Eastern medicine is how it ties in the mental emotional aspect of physiology. There really is no separation, and there's no need really to say mind body. It just is inherently connected. And I wanted to bring in too, I've been listening to this physicist, Nassim Haramein, and I like how he used these kind of science words to explain what I'm starting to talk about. He says, this method of doing science, reductionistic approach, has very successful effects in terms of getting the details of everything, but has a large downside. It is that you start to lose the picture of the whole thing. You start to lose the understanding of the whole thing and how it interacts, how it works. You start to think that all these things are separate when really the whole thing is in relationship. And Heiner Fruhoff, my Eastern mentor, would say over-specialization is a serious problem in modern medicine because it leads to a way of looking at the body that does not consider the complex ways in which the body's functions are intricately intertwined. I think probably as CIRS patients, we've seen this, in ourselves and others. You might go to multiple specialists and people are saying nothing's wrong, or you get different information. And I know in people that I've helped, it's been upsetting that kind of no one's talking to one another. We're approaching this more from a holistic perspective. However, also at the same time, And CIRS, I think the beautiful part of the reductionistic side is all the beautiful research that Dr. Shoemaker has done. We've got these amazing lab values and imaging and testing for our homes and our offices for exposure. And also research to confidently show, the efficacy of the protocol, for example, in treatment of VIP. It's just fascinating to see things and changes like the neuroquant values and gene expression and all of the hormonal inflammatory markers. So yeah, I love, the Jupiter approach, which is what I do. It really combines the holistic Eastern with the reductionistic Western. And I love the combination and the crossover of the two. One last thing I'd like to bring in, we might be able to talk about this. I know you and I both share a love of meditation and the spirit is the three treasures, which comes from Eastern medicine. It's the three are the Shen, the spirit, Qi, or our life force, and essence, which is our physical body. And one of my first teachers, who since passed away, said, imagine a person riding a horse. So the spirit is the rider, the Qi is the movement of the horse, and the essence is the body of the horse. And all these three affect one another. I've sort of been navigating this in the last 2 years, sort of understanding from that CIRS perspective. CIRS affects the physical body. So let's say we're in a hypometabolic state, right? Where we are low on energy. Our body is not good at making energy. So if that's the horse, it's not going to be galloping through the fields, and the rider needs to adjust. There's an interplay of how you're interpreting, not doing the things that you like to do, or that different feeling of a hypometabolic state, of your metabolism being low. Let's say the horse, the body is inflamed. There might be a bumpy ride. There might be irritability and pain, and so the Shen, the rider, needs to kind of come in and adjust. And we do this with, from our meditation practice and increased awareness. Like, oh, okay, so easy, girl. Like there's a different understanding, and there's a different way that you'd interact with the horse. And yet the rider could feel, frustrated and scared and sad and angry. And so these emotions can drive thoughts, and then those emotions and thoughts can affect the Qi, right? The movement of the horse. I love this interplay. We talked about my background a little bit with psychology and physiology. I love this interplay of physiology affecting the mental emotional state. Mental emotional state can also affect the physiology, and then interconnecting all those with the spiritual practices of awareness and just navigating through all that, which I think becomes quite complex in CIRS and Goose syndrome. So what is Goose syndrome? Its most simple definition, it's a complex chronic multi-parasitic infection. The symbol for it is 3 worms in a pot. It's this multi-parasitic infection that gradually drains the yang qi, the life force of the host. The pictogram for it is wind under mountain. So the wind is gradually depleting and taking away the stability of the mountain. So there are these two things. You have an excess coming from the outside, the infection, and then you have the depletion of the host. We differentiate it into 2 facets. There's brain goo and gut goo. I'll start with the gut first. So this would come from intestinal infections. They'll include the protozoal infections, amoeba, giardia, plastocystis, worm infestations, tapeworm, roundworm, or other degenerative infections like schistosomiasis, sheep and liver flukes, systemic candidiasis, and those type of infections. And then brain goo is coming from nervous system infections. So obviously our Lyme disease pathogen, Borrelia, and its other co-infections such as babesiosis, Bartonellosis, anaplasmosis, and it can be other things like Rocky Mountain spotted fever, tick-borne encephalitis, and other chronic nervous system infections. These are most often transmitted by the bites of ticks, mosquitoes, fleas, lice, spiders. originally it was called, and there's another word for it, Neuer syndrome. This was primarily the malaria that we would see, and it's called torture disease. Many different kinds were reported, and so this would also relate to dengue fever and West Nile virus. There is a separate chapter that follows Neuer syndrome. It's called Feng Quang, and it describes the cognitive and the emotional issues that we see that patients suffer from.
How then are you treating when you see this combining together this knowledge and this framework of Eastern medicine along with the research from Dr. Shoemaker? How does that look for you when you're working with patients?
And it's going to be, complex intake and going back with the health history, all the way to zero from when you were born. And then any major life events that have happened along the way. Comprehensive intake. And then I do like to lay the foundation with the Shoemaker protocol and do the testing to set up an initial baseline and differential diagnosis. So that is on board. Then I go in a little more deeply and ask questions that would be specific to Eastern medicine diagnosis. I want to back up a little bit here. One thing that I didn't mention previously is that Goose syndrome, although part of Eastern medicine, is not part of TCM. TCM stands for Traditional Chinese Medicine, which is what is taught in modern times after the 1950s. In every major medical book in ancient China that starts with the Neijing, the Yellow Emperor's classic of medicine about 2,200 years ago, there are writings on Goose syndrome. However, it was taken out of TCM. That's why I'm thankful to Dr. Heiner, who originally got a PhD in Chinese sinology, and after hitting what many providers have hit, being unable to treat with TCM, I was remembering a woman who has, now looking back, has Goose syndrome, has CIRS, and I had to write these like super complicated formulas. I had to give one for the morning, one for the evening. I was like, wow, this is just like so complex. There's so much going on. Even Heiner will say, don't revert back giving these formulas that will try and give from a TCM perspective, like Lujin Sitong, Gui Pitong, Xiaoye San. They won't work. I've personally been on all three of those formulas. So this is coming out of the TCM framework and going back, and this is quite specific. I just specialize in this. It's quite complex, and it has its own set of formulas, its own set of acupuncture points, its own method of treating. So coming into the Eastern side, I've set up that Western foundation. I'll go through a symptoms picture, which is quite similar to the signs and symptoms questionnaire that you'll get in the Shoemaker protocol. So there are digestive systems like chronic diarrhea, loose stool, all these IBS symptoms, abdominal bloating, cramping, nausea, neuromuscular symptoms like muscle soreness, heaviness, weakness, wandering body pain, numbness, tingling, neuropathy, and then, the aversion to bright light, the sensitivity to noise and sound, smell, mental symptoms like depression, flaring anger, fits of rage, an inner restlessness, insomnia, confusion, chaotic thought patterns, even seizures. And constitutional, and this would be different, it's this sort of progressing state of mental and physical exhaustion, and then some more symptoms that are specific to Eastern medicine. Now that we've laid that foundation, so now what am I doing from an Eastern perspective? And then this will go into treatment. I'll make that differentiation between gut and brain goo. And I'd also like to say that there's interplay between the two, right? We know from Western medicine that the vagus nerve, connects the gut to the brain, and the gut is very innervated with nerves. A gut goo person is going to get brain symptoms, and a brain goo person is going to get gut symptoms. There usually is a primary one. And so then from distinguishing that, then I'm going to choose herbal formulas. And so now we can come into the herbs. The approach is a little different from Western, and kind of speaking back to what I spoke to earlier about how that holistic view of illness. So we are both doing, we would say, anti-goo, but we're also doing a pro-terrain, pro-person, if you will. We want to get rid of the infection, but we also want to nourish the person so that their body eventually can kind of fight off the remaining pathogen. We don't want to cause more, the word is shang, we don't want to cause more injury to the warming forces of the body. Then treatment goes in stages. So in that first stage, when I'm seeing them, this will be typically the first 6 to 12 months, we're decreasing the inflammation and the infection. I'm also going to be nourishing from an Eastern perspective, I'd say the qi, the yin, and the blood. Qi is more like your energy, and yin and blood is more the substance of the person. Then in the second stage, I'm going to continue to decrease the inflammation and the infection. Now the system isn't overwhelmed by the infection, so I begin to tonify at a deeper level of that yang qi, of that vital energy. And this typically is 6 to 30 months. And then the last stage is the third stage, I'm really focusing on recharging the batteries, if you will, restoring the self-healing ability of the body and its vitality. There's a beautiful herb that does this. It's called futsa or aconite. This is a beautiful herb that, I would say the innate immune system is like, I got to get this infection out of the system. It's like the energy is just up and at the surface. Futsa is able, we say, to kind of like take that energy and bring it back down into the gate of vitality, the Mingmen. So kind of like bring that energy back in and put it back into storage. And in that first stage, I'm going to use, when I worked with Rosa Schneider, she was looking at research design, and there's something called semi-individualized. So you're using a protocol that pretty much everyone gets, but then you're taking that kind of core treatment and you're individualizing it for each person. So we have 3 core formulas that we use, one more specifically for digestive goo, one for brain goo, and one more for an acute infection. These have 5 categories to them. One is to kill the toxins, kill the goo toxins. And then we know from Western research, this one is specifically good for Borrelia or other specific infections. But there's always some of those herbs in the formula. And then one that is more kind of like smudging the system, or we're making the system uncomfortable for the pathogen. And that would be something like mint. In the previous category, that might be something like Artemisia. And then there's a formula, a category called Calm the Spirit. This is to help with the anxiety and the insomnia. The adrenals and the thyroid are typically shot. They're also antiparasitic. So that's another thing about Eastern medicine. It's like each herb is like a person. There's many characteristics of that herb. So when we're calming the spirit, we're using an herb that does that, but plus it has antiparasitic functions to it. Then another category called tonify the qi in the blood. We're nourishing the energy, we're nourishing the substance. We're also sort of bringing the herbs to those layers to be able to affect the pathogen. Then the last one in Eastern, we'd say it's move qi in blood. But from a Western perspective, we'd say this is breaking down the biofilm. An example of that would be aged tangerine peel. An example that I didn't give of calm the spirit would be lily bulb, and of qi in blood, that would be white peony. Tried to pick out some herbs that are common. The core formulas, so these have been written about for a long time, but some of those formulas had quite toxic substances to them, like heavy metals. So the core formulas today that Heiner created are based on Suhutong and Jiajiang Suhutong, which was written in 1823. He did modify them for modern times. We tend to be more, we would say, yang deficient. A lot of us have had exposure to antibiotics, which are a yang Ming drug. We would say they're quite cold. That depletes that system, and as well our lifestyle, right? We're we're not in nature as much. We're not being nourished. We're kind of running around, and then also depletes our yang qi. So I'll do one of the core formulas, and then I'll combine it with a supporting formula. And there's multiple formulas. I just wrote a prescription for someone. He's like, well, can I just pick it up? Like, no, I have to ship it to you. There's like hundreds of choices that I have to pick what's right for you. And so these supporting formulas would be, it might be focused on poor digestion, or maybe it's a botched brain chemistry, body pain, and then it could be skin. It could be kind of that migraine, pain on the side of the head, nausea, acid reflux. There's even ones that are more for, I would say, long-term brain goo that's morphed into the autoimmune, like Parkinson's, MS, Alzheimer's. It might be, a woman that has more predominant menstrual issues and depression, or it might be more severe digestive issues like a colitis, or Crohn's disease. Perhaps it's more autoimmunity, or it's more like prostate or urinary or lung or endocrine, or even with Lyme, there might be an inflammation of the epithelium. And so it's taking the core formulas and then combining them with the supporting formulas that are appropriate for that person. Then lastly, it's using more of the aconite based formulas to recharge the batteries, to bring that energy back in and calm the system down. In the goo patient, we say the energy is predominantly in this sort of fight or flight state at the surface. And so in order to heal, we've got to put that energy back inside the gate of vitality, and tell the body it's okay, calm down the system. A note on dosage, and you and I have talked about this, Herxheimer reactions. We start small and we gradually increase. That's actually a confirmation of goo, that the patient calls back and said that they've had a reaction, even to a small dosage. I know in my personal experience, I started on a small dosage, and just in my nature, I'm like, I can do this, and it was too much. So when I called and spoke to my colleague, he's like, no, you got to start even slower than that. And these formulas that we're using for you, they're very well balanced. They're not, excessively, we would say, cold in nature or hot in nature. So if you give them to a healthy individual, they're not going to get a reaction. They were using them during the pandemic as a preventative. Again, we can say treatment informs diagnosis. Because this is so specialized, there's such a depth and complexity in this medicine, and there's really the capability to prescribe a highly specific and individualized treatment protocol. You sort of need that experience of the provider to make that diagnosis from an Eastern perspective. Even I can't treat myself, and I can kind of get it, but I need that outside eye to see what the proper differential diagnosis is. And then, even if I prescribe something in a Western way, like there's one formula that's particularly good for body pain, if that doesn't match the underlying individual diagnosis of the person, this is not going to work for them. It's a little tricky to get them just right for that person.
I love how individualized everything is. I love how it's addressing, the multiple systems that are affected through the illness. The one question that comes up for me as you're describing all of this is binders. So we know the work of Dr. Shoemaker, how important it is for the HLA susceptible to be on the proper binders to remove the toxins from the body. So how does that interplay with all of this?
That's a great question. Yes, and that's something that's not in Eastern medicine. So I use it from the Shoemaker protocol, and the people that I work with are all following that part of the Shoemaker protocol. I think it's very, very important. So again, taking the best of both worlds. Yeah, it's not within the Eastern medicine, and it's an important piece.
Yeah, I want to flag that for people. I know in my own experience before I knew of CIRS, just like when I was having digestive issues way prior to any official CIRS diagnosis, very functional and everything, but I was doing a lot of acupuncture. And they were giving me different formulas, more from probably a traditional Chinese medicine perspective. And I was getting so sick.
Yeah.
I don't know now if I was in mold exposure or if I was tapping into underlying Lyme and tick-borne co-infections. We could speculate
Mm.
either at that point what was happening,
Mm-hmm.
but I wish I had binders then, right? Because that would have made that experience very, very different. So I love how you're working is combining that into that Eastern piece, because that seems like something that the Eastern medicine can really adopt for that HLA susceptible person.
Yes. And for you, it could be, and this brings up something I haven't mentioned yet. So it could be that you were, and I don't know, it could be that you were getting herbs that were starting to kill off the pathogen. You're getting that Herxheimer response. So feeling very sick from that. It can also be there are herbs that are contraindicated in treating GU syndrome, like something very common, ginseng,
Mm.
because it tonifies the pathogen at the same time.
Mm.
So in my own examples, I saw one of my teachers when I was going through graduate school, just gut wrenching fatigue. I told him, I said, I feel like I can't even sit up in class. Like I'm so tired. So we did high dose ginseng and the good quality and, the Chinese ginseng instead of American ginseng. That's not the treatment answer for someone with CIRS. So it can be trying to address your symptoms from a TCM perspective, and without knowing about GU, you're not going to be treating it correctly for a couple of different reasons. And if you're having, and also you need to know the knowledge to not prescribe too much too soon because of that Herxheimer reaction. Like I just started working with someone, I'm doing supporting form. His symptoms are so severe. I'm using supporting formulas to get him to a place where I can introduce that GU formula for him. So yeah, I think it's multifaceted. Yeah.
I'm glad that you have that nuance and awareness to tap into that for people and to be really gentle with it.
For sure. Yeah, it's important.
The herbals, we touched on this a little bit. I'm curious because I've heard, about different Asian countries having high levels of lead showing up in different formulas. So how do you stay aware of that for your patients?
That's a pretty simple answer. I'm going to answer that, and then I'm going to answer about aconite. I want to touch on that. So when you're working with the herbs, you work with a company that is independently testing it for the heavy metals, the pathogenic bacteria, pesticides, herbicides. Then you look to where they're growing it. So for example, Heiner's formulas, I know that he's chosen the correct place to actually grow them, the correct procedure to cultivate them, in addition to them being independently tested for all of those toxins. And then a specific word on aconite, on futsa, that can be a very toxic herb if it's not processed correctly. So I know and trust that the company that I'm using process it in the correct way. It also, aconite needs to be combined with the correct herbs to increase its usage and mitigate that toxicity. So that's an important question to ask. Yes, so you want to go to the correct source. You want to be using a company that does all the above.
It sounds like really making sure that you vet who you're working with in this regard is very important for the GU CIRS patient.
Absolutely. Yeah. I mean, I think in anything that you're treating, when you're dealing with herbs, you want to make sure that you're getting a good company. You don't want to just be sort of haphazardly ordering from Amazon. You want to make sure that it's medical grade, and there's a couple of good companies that are out there.
Well, I think people are going to be fascinated with hearing about this and really interested and excited to know that there, is an alternative way to work through the protocol and really support the body, the mind body, and have some options on how they can really overcome CIRS and support themselves in the process. I'd like to shift into a couple other areas I know you have, a lot of knowledge on. That I teach meditation to people with CIRS, and through my own experience, I found that there's a certain time that seems to be better to either have people be introduced to mindfulness practices for the first time or to start meditation again. That for me, anecdotally, has really been step 3 of the protocol. When the inflammation goes down, they're maybe treating Marcons, they're passing their visual tests, they're binding stuff up. There are practices like acupuncture and Qigong that we also know are really supportive to the whole system. What would your recommendation be in regards to timing of acupuncture and Qigong so that we're not interrupting the natural healing process of the body?
Great question. For acupuncture, I think the more important piece is the provider that you're seeing. So something that would be contraindicated would be, a provider who is very kind of has a very yang style, strong needling and, more of that kind of muscular skeletal approach. It might be very good with athletes, that's what their body needs. You're going to need somebody that's really using more their sense of touch, that has gentle needling, that's aware of how deficient you are. There may be a time, where your body is too deficient for acupuncture. But I think the more important piece is who is doing the needling. Most points are chosen based on touch. There is a lot of points that are used on, let's say, the yang ming channel, the stomach and the large intestine. And one more piece of that, there might be emotional discharges during needling. Yeah, it's all related. But in terms of your question about timing, I think that's more choosing the right provider. There may be a time where you are too deficient to receive acupuncture because it is moving the energy even when you have a gentle approach to it. Secondly, I think Qigong can be done, really at any time. There's some breathing techniques that are specific to Gu syndrome. There are certain acupressure points that are specific to Gu syndrome, and you can use an essential mint oil to stimulate those points. Again, you wouldn't want to do a Qigong practice that's very vigorous, that would move your Qi too much, but something simple and short would be appropriate.
Wonderful. Is there anything that you can share so far in terms of treating patients in this way, what you've noticed so far in response to treatment?
I think the biggest thing that I've seen so far is, and similar to the Western CIRS approach, is showing the person how everything is related, and then mapping out that treatment protocol that addresses things in certain stages and in a certain protocol. So lending that person the understanding of what's happening, how it's all connected, and then how you're going to move forward from here. For me, that's been the biggest piece of like, okay, it gives a lot of comfort, it gives relief, it gives understanding, peace of mind to them, and being able to have that dual approach where you're addressing the underlying cause, the root, and then you're addressing the branch, or the branches, the symptoms that the person is experiencing. So that holistic approach really brings a lot of comfort and relief to the person.
What do you wish people in the world knew about CIRS?
To me, that also relates to what I wish the educated, kind of the professionals know. Just from that particular question, coming back to what I love this interplay between the mental, emotional, physical body, just how interconnected everything is, so somebody who has CIRS, their physiology is going to affect every aspect of their well-being.
What do you wish that non-CIRS educated doctors and wellness professionals knew about CIRS? This could probably be a whole podcast episode.
So that, just these people that you have, this multi-symptom patients, the chronic fatigue syndrome, fibromyalgia, the unexplained headaches, stomachache, refer out, refer to a CIRS provider, these people that are so hard to treat and, have all of the above, refer to someone who knows how to treat CIRS.
If you could have one magic wish granted, what would you ask for to happen within the CIRS community specifically?
I think you're going to like this. So when I read that question, I had this image of, I don't know if you're old enough to watch MASH back in the, I think it was 70s, maybe in the 60s. It was just this big community with all of these, the doctors and all the staff were there, and, and the patients were all there. I just had this image of you're getting out of exposure and you're sick, and you can drive to this big nature area, and there's tents, and you get to live and breathe the fresh air. You can take walks in nature, and then you're in a community that understands CIRS. You can begin to get your treatment for it. That would be a magic wish.
I love that. And I do remember MASH. Remember the theme song well.
Yeah.
Yeah. Yeah.
Yeah. Yeah.
And what keeps you hopeful day to day?
So I have two pieces of this. I mean, just like academically, all the modern research that we have on it is amazing. You can see that it's been treated from an Eastern perspective. You've got 2,000 plus years of physicians treating it, and the understanding of the physiology and the treatment approach. And then on a level that, even it's been interesting, even all that I know about it in myself, I've just had moments of nervousness. So the deep comfort really comes more from that spiritual connection, connection with nature, with my dog, just love. Also, I think, the mystery of the fact that I was just by mistake, brought to the Shoemaker teachings and to the teachings of Goose syndrome from Heiner and others. So, just seeing the blessings that have occurred and being grateful for those.
Thank you so much for your time today to share all of what you've been studying and how you've been practicing. It really is inspiring to see how you're bringing the Eastern and Western models together to treat people more holistically as they go through CIRS recovery. I really look forward to how your work unfolds and how it continues to grow and expand in the CIRS community. How can people get in contact with you or work with you at this point? Can you share a little bit about that?
Yes, so you can reach us via email or phone. Email is thejupiterapproach@gmail.com. Website is in progress. It's thejupiterapproach.com. And then you can reach us by phone or WhatsApp at 561-339-7717.
Wonderful. Any last words you'd like to share?
Thank you for the opportunity. I hope that I was able to kind of express, this joy in combining the wisdom of Eastern and Western medicine. I've been through it. I know the difficulties of it. I've dedicated the rest of my practice to helping others with CIRS and GU. So thank you, Melanie.
Thank you. Thank you for listening and for your kind attention. To keep in touch, follow the Heart of CIRS podcast on Instagram. You can visit melaniepensack.com/The Heart of CIRS to donate. Your generosity helps to keep this podcast growing. May the awareness of CIRS spread far and wide, helping to change millions of lives for the better.